name's Brianna, and I'm one of the supervising nurses here at the facility. I'm going to be conducting your interview today.
Hi, it's nice to meet you. My name is Shelby.
Okay, so for the interview, with COVID, everything going on, we're going to be doing the virtual interview. So we'll start with that. I have several questions I'm going to go over with you, and I'll give you time to answer those.
Sounds great.
So question 1 says, tell me about a time in clinicals at FTCC in which you delivered high quality, patient-centered care to individuals, families, groups, and communities in varied settings.
So I have worked with many individuals and families over the last 2 years that have all given me great learning opportunities and clinical experiences. But one of my favorite clinical experiences was when I had the opportunity to work with the Manna Dream Center to serve and offer our services to the local homeless community. My peers and I sorted through the items that were donated to the organization in order to find winter clothing for the upcoming cold weather and bags for them to carry their belongings. We also served lunch and offered a listening ear to anyone that had concerns or just wanted a meaningful chat, and gave information on where they could go to receive vaccines and other preventative care. As a result, we provided food, comfort, and warmth to the individuals, families, and friends of this displaced community.
I really like that you incorporated not only the nursing and the healthcare setting, but also to the community outreach. That's very good. So question 2 is, why does this example meet this objective?
This example meets this objective because while it may not be a healthcare setting, we are providing valuable resources for a part of our community that may not have the means to obtain or maintain their basic needs. Nursing isn't only about treating acute or chronic diseases, disabilities, and injuries. It's about preventative measures and providing the resources and education to help people maintain their basic health and bodily needs. Healthcare is not black and white. It does not only live in a clinical setting. It's about helping people of all backgrounds, ethnicities, social status, ages, and genders.
All that is very true, and education, research, and community outreach is very important. Tell me about a time how you used something you learned from one of your class assignments to incorporate best practice and professional values and standards into compassionate nursing practice.
In Nursing 112, we learned about advanced directives and what resources and interprofessional communication could be utilized when filling out these forms. During one of my clinical rotations in this class, I had a patient that was recovering from stroke and wanted to fill out an advanced directive so that his daughter would not have to make the difficult decisions on her own. He originally thought he would need to obtain a lawyer to establish a directive like this, but I informed him that the hospital provides this service for their patients. As a student, I informed the RN in charge of his care of his wishes, and she and I contacted the hospital's case manager to assist him and his daughter with filling this directive out. As a result, they were able to ensure the patient's wishes were known if something were to happen later, and were appreciative of the hospital staff for making it an easy process.
That is all good information as well. Did the outcome of using this new knowledge improve the outcome of the situation you used it for? Why or why not?
By utilizing this information we learned in class, I was able to obtain the proper resources for this client, and he avoided unnecessary lawyer fees to create an advanced directive. His daughter was relieved now that she had his wishes and wants for his care in writing and would not be solely responsible for these decisions should the need arise.
Alrighty. Tell me an example of how you have demonstrated cultural and global congruency in the healthcare environment with diverse populations in promotion of healthy lifestyles and preventative health screenings and clinicals at FTCC.
During clinicals, I once was caring for a Hispanic patient who spoke very little English. As a student nurse caring for her, I needed to perform an assessment and administer medications. To ensure that this patient understood the care she was receiving, I obtained an interpreter phone that was available in the unit for a trained interpreter to relay the information to the patient. As a result, the patient was able to understand what care we were giving her and the medications we were giving her and why, and be able to ask questions if she had any.
How does incorporating this impact how and what you present in patient discharge information and education?
This would not impact the information that's given for discharge education information, but how it's relayed to ensure the patient understands the teachings and information given. This will allow her to ask questions and ensure that she understands what's being told to her, rather than leaving the hospital and not knowing why she's taking medications and possible side effects or interactions. Understanding the need for medications and other care needed after discharge may also reduce the risk of readmission and complications.
Reducing risk of readmissions and also making sure a patient is well educated is very important. Describe a situation in SIM or clinicals at FTCC where you functioned as an effective member of healthcare team demonstrating excellent interprofessional collaboration.
During one of my clinical experiences, I was performing a physical assessment on a patient that had just undergone a knee arthroplasty the day prior. During my assessment, I found that the surgical wound on this patient was red and swollen with non-odorous, blood-tinged drainage soaking through the dressing placed by the previous nurse. The patient presented with soreness around the area, but no fever. I reported my findings to the patient and the patient concerns to the nurse mentor caring for this patient and recommended contacting the doctor in charge of this patient's care due to the possible infection and because the patient is receiving anticoagulants. After reaching out to the doctor, I was informed that they reassessed the surgical wound and determined that there were signs of a possible infection and prescribed antibiotics. Thanks to excellent interprofessional communication, this patient avoided possible serious complications from infection.
What skills have you learned in classes at FTCC that have increased your communication skills in SIM and clinicals at FTCC?
I pride myself in the therapeutic communication skills that I've enhanced and developed during my time at the FTCC nursing program. One clinical experience, I was assigned to a patient who was nonverbal and paraplegic due to a previous stroke. I was nervous to care for this patient because I was unsure how to know what the patient's needs or preferences were, as I like to make sure my patients are involved in their own care. I started by talking to him as I would for any other patient by explaining what I was doing and why. After spending some time with this patient, I learned that if I asked the right question, he would nod his head or mutter a quick "yeah" as a response. As a result, he was able to make some independent decisions that may not have been offered before. I also notified other staff in charge of his care about this finding so that they can communicate with him as well. I make it a point to remain flexible, patient, and non-judgmental as I can when providing therapeutic communication with my patients, even if the conversation is mostly one-sided.
Those are all great ways to use therapeutic communication and to overcome barriers when communicating with our patients. Describe how you have demonstrated beginning skills in point of care leadership, management, and care coordination using effective communication skills through either successful completion of class projects or a clinical situation or experience.
During one of my rotations during nursing 212, I shadowed the charge nurse and assumed the same responsibilities over my peers for the day. My new role was to offer help with tasks, delegate assignments, observe rounds with providers, and offer feedback to ensure patient safety. I was able to point out errors in PPE use and hand hygiene, as well as help my peers with tasks that are time-consuming or require at least 2 people. I also made rounds on each patient to ensure that patient needs are being met. The outcome of this day was a new appreciation for our leadership team and a better understanding of what it means to lead a team that puts patient and safety first.
How do you plan to grow and strengthen your leadership skills in your practice as a nurse?
To improve my leadership skills, I intend to push myself to take the team lead roles or leadership opportunities offered to me and learn how to be more assertive. I also plan to use my skills and knowledge to improve my practice, but also observe people and peers around me that are in leadership roles with themselves. I believe communication is one of the most important skills to be a great leader. We must be able to communicate interprofessionally and intraprofessionally to be active listeners and incorporate evidence-based practices into our everyday responsibilities. By having open communication, we are able to create more positive patient outcomes and higher satisfaction among coworkers.
Describe how you implement safe and competent care to individuals through both system effectiveness and individual performance in varied healthcare settings.
In every clinical experience I have had, patient safety is my highest priority of patient-centered care. It's my responsibility as part of the healthcare team to implement safe practices. I do this by utilizing hospitals' informatics system when performing medication administration, as well as using appropriate PPE for each patient. The informatics system helps me to confirm orders, the 6 rights of medication administration, identify any allergies, and it also has safety checks to ensure I do not overlook important information or chart on the wrong patient. As a result, medication errors are less likely to occur. As an individual, I also ensure that I wash my hands before and after entering or leaving a patient's room and ensure the appropriate PPE is worn and discarded appropriately to protect the patient, myself, and other individuals in the healthcare setting. This increases infection control and results in fewer hospital-acquired infections.
Those are all great quality skills. Tell me about a specific clinical situation in which you identified something unsafe for a patient and what you did about it then and why. Would you change what you did then now? If so, why and what would you do differently?
During one of my clinical experiences, I was assisting my nurse mentor gather the medications needed for our morning med pass. This patient was receiving at least 10 medications. After the medications were pulled, we entered the patient's room and began the process of our med pass. As a second-year student nurse, my nurse mentor gave me the responsibility of obtaining the patient's name and date of birth and explained to them what medications they were receiving and why. She then gave me the responsibility of administering the medications. A nurse mentor would be there to help if needed. However, as I was preparing the medications, my nurse mentor stepped out of the room and left me alone with medications and the patient's medication administration record under the nurse's login. As soon as my nurse mentor left the room, I immediately stopped what I was doing and set down the medication. I then pressed the call bell and asked for an RN or FDCC instructor to please come to the room for assistance. My nurse mentor came back into the patient's room within 2 to 3 minutes and asked why I have not finished giving the medications. I politely informed her outside of the patient's room that as a student nurse, I'm not allowed to practice medication administration alone and that it's unsafe to leave any medications with a student or to leave them unsupervised. It's unsafe for a patient to receive medications from an unlicensed personnel that is unsupervised. Looking back at the situation, I do not think I would change what I did because I believe it was handled correctly and professionally to ensure patient safety.
Unsafe practice is very important to keep an eye on, and I think that you did the right thing in that situation. We have completed all questions for your initial interview. Is there anything that you need to ask me or any concerns that you have?
No, ma'am. Thank you for having me today.
All right, thank you.